Are you struggling with tension headaches or migraines? Butalbital might just be the solution you've been looking for. In this video, we will explore the common uses, recommended dosage, potential side effects, and user testimonials of Butalbital, providing you with all the information you need to make an informed decision. Butalbital is a medication that belongs to the barbiturate class and is primarily used for the treatment of tension headaches and migraines. It works by relaxing muscle contractions and reducing the overall intensity of the headache. This can provide much-needed relief for those who have been suffering from chronic or severe headaches. When it comes to the recommended dosage of Butalbital, it's important to consult with your healthcare provider, as they will determine the appropriate dosage based on your specific condition and medical history. Additionally, it's crucial to be aware of potential side effects that may occur with the use of Butalbital, such as drowsiness, dizziness, and gastrointestinal disturbances. To gain a deeper understanding of Butalbital and its effectiveness, we will also include user testimonials, allowing you to gain insight from individuals who have first-hand experience with the medication. So, if you are curious about Butalbital and its uses, dosage, side effects, or user experiences, keep reading to learn more. Common uses of Butalbital. Butalbital is commonly prescribed for tension headaches and migraines. Tension headaches are characterized by a dull, aching pain that can be felt on both sides of the head. These headaches are often caused by muscle tension and stress. Migraines, on the other hand, are more severe and can be accompanied by symptoms such as nausea, vomiting, and sensitivity to light and sound. Butalbital is usually used in combination with other medications, such as acetaminophen and caffeine, to enhance its effectiveness. The combination of these ingredients targets different aspects of the headache, providing more comprehensive relief. It is important to note that Butalbital should not be used for prolonged periods or as a daily preventive medication for headaches, as it can lead to dependence and rebound headaches. Recommended dosage for Butalbital. The recommended dosage of Butalbital can vary depending on the individual and their specific condition. It is important to consult with your healthcare provider to determine the appropriate dosage for you. Typically, the recommended starting dose for adults is 1 to 2 tablets, containing 50 mg of Butalbital, every 4 to 6 hours as needed for pain relief. The maximum daily dose should not exceed 6 tablets. For children, the dosage is based on their weight and should be determined by a healthcare professional. It is important to follow the prescribed dosage and not exceed the recommended amount, as higher doses can increase the risk of side effects. Potential side effects of Butalbital. Like any medication, Butalbital can cause potential side effects. Common side effects include drowsiness, dizziness, and gastrointestinal disturbances such as nausea and vomiting. These side effects are usually mild and temporary, but if they persist or worsen, it is important to consult with a healthcare professional. In rare cases, Butalbital can cause more serious side effects such as allergic reactions, liver damage, or blood disorders. It is important to seek medical attention immediately if you experience symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing. User testimonials and experiences with Butalbital. To gain a deeper understanding of Butalbital and its effectiveness, let's take a look at some user testimonials and experiences. Sarah, 34. I have been suffering from tension headaches for years, and Butalbital has been a game changer for me. It provides fast relief and helps me get through the day without being constantly bothered by the pain. John, 42. I was skeptical about taking medication for my migraines, but after trying Butalbital, I am a believer. It not only reduces the intensity of the migraine but also helps alleviate associated symptoms like nausea. It has significantly improved my quality of life. Emily, 27. I started taking Butalbital for my tension headaches, and while it did provide relief, I noticed that I became dependent on it. I would get rebound headaches if I didn't take it regularly. It's important to use this medication responsibly and not rely on it as a long-term solution. These testimonials provide a glimpse into the experiences of individuals who have used Butalbital for their headaches. It is important to remember that everyone's experience with medication can vary, and what works for one person may not work for another. Precautions and warnings when using Butalbital. Before taking Butalbital, it is important to be aware of certain precautions and warnings. Butalbital can cause drowsiness and impair your ability to drive or operate machinery. It is important to avoid these activities until you know how the medication affects you. Butalbital should not be taken by individuals with a history of addiction or substance abuse. It is also not recommended for individuals with certain medical conditions such as liver or kidney disease, respiratory disorders, or a history of porphyria. Additionally, Butalbital should not be taken with alcohol or other sedative medications, as this can increase the risk of side effects and respiratory depression. It is important to inform your healthcare provider of any other medications you are taking to avoid potential drug interactions. Alternatives to butalbital for pain relief. If butalbital is not suitable for you or you are looking for alternative options, there are several other medications and treatment modalities available for pain relief. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen, can be effective for mild to moderate headaches. Triptans are another class of medications specifically used for migraines and can provide relief by constricting blood vessels in the brain. In addition to medication, lifestyle modifications such as stress management techniques, regular exercise, and adequate sleep can also help reduce the frequency and intensity of headaches. Alternative therapies such as acupuncture, massage, and cognitive behavioral therapy may also be beneficial for some individuals. It is important to discuss these options with your healthcare provider to determine the best course of treatment for your specific needs. How to safely stop using butalbital. If you have been using butalbital for an extended period and want to stop, it is important to do so under the guidance of a healthcare professional. Suddenly stopping butalbital can lead to withdrawal symptoms such as anxiety, restlessness, and tremors. Your healthcare provider may recommend gradually tapering off the medication to minimize withdrawal symptoms. They may also provide alternative pain management strategies to help you transition off butalbital. It is crucial to follow your healthcare provider's instructions and not abruptly stop using butalbital without proper guidance. Consultation with a healthcare professional before taking butalbital. Before starting butalbital, it is important to consult with a healthcare professional. They will evaluate your medical history, current medications, and any underlying conditions to determine if butalbital is suitable for you. During the consultation, be sure to mention any allergies or sensitivities you have, as well as any other medications or supplements you are taking. This will help your healthcare provider make an informed decision about the appropriateness of butalbital for your individual needs. Conclusion. Butalbital is a medication commonly used for the treatment of tension headaches and migraines. It provides relief by relaxing muscle contractions and reducing the intensity of the headache. However, it is important to use butalbital responsibly and under the guidance of a healthcare professional. The recommended dosage of butalbital should be determined by a healthcare provider based on your specific condition and medical history. It is crucial to be aware of potential side effects and to seek medical attention if they persist or worsen. User testimonials can provide valuable insight into the experiences of individuals who have used butalbital. However, it is important to remember that everyone's experience with medication can vary. Before taking butalbital, it is important to consult with a healthcare professional to determine the appropriateness of the medication for your individual needs. They can provide guidance, monitor your progress, and suggest alternative treatment options if necessary. Remember, proper communication with your healthcare provider and responsible use of medication are essential for effective pain management.